Hello, I'm Tom Warsnop, Executive Manager at the Summer Foundation.
And I'm Michelle Bolt, Health Engagement Lead at the Summer Foundation. My clinical background is social work, but I've also worked as an NDIS project lead at a health service, helping them build their NDIS capacity.
This brief introduction to our resources provides some key fundamentals on how health can best prepare to work with the NDIS. Since 2006, the Summer Foundation has been working on the issue of young people stuck in nursing homes or being forced into nursing homes. Currently, over 2,000 young people enter aged care every year. That's over 40 every week, most of those coming from hospitals. With the rollout of the NDIS, we have a great opportunity to change this situation. A key building block is to work with you as health services so that you're equipped well to ensure that young people who have disabilities are able to find a better alternative. The NDIS is now a reality, and how we support people with disabilities in this country. The NDIS is everybody's business, and you can draw on it, as well as providing support for other people through it. The NDIS may initially seem to be the responsibility of just the disability sector. However, health services can be heavily impacted unless they work well with the NDIS and its structures. When health services have been able to work effectively with the NDIS, then that has reduced the lengths of stay for hospital patients with a disability and reduced their readmission rates as well. There is another reason now for why we want to work effectively with the NDIS. The Commonwealth Government has now adopted a policy of ensuring that no young people go into nursing homes by 2022. For health services to adapt and to meet these targets, practice change is going to be required. This training provides your staff with all of the essentials you will need to be able to work effectively with the NDIS. What is essential to understand though, is that information about the NDIS is only part of the solution. What you need to be able to do is to learn how to work with the NDIS in its day-to-day activity. This training we have to offer will not change your practice on its own. The NDIS has been a major interruption to the way things are done in this country, in disability services, but also in other services. Health services that have recognised this early have done much better. Essentially, a change management approach is required. The Summer Foundation's training helps to identify all of the key parts of that change management process for you. Keep in mind that investing well in this process will mean that your hospital will be able to make this become business as usual, and people with a disability will be able to be supported much more effectively. In turn, that will support efficient discharge planning, and it will also reduce lengths of stay in your beds. The NDIS has a relatively simple overall goal for people with disability to have more choice in their lives, particularly around where they want to live. Translating that into the business of discharge planning for health requires some detailed work. Staff need support to understand the NDIS, but also in knowing how to work with eligible patients in an efficient and a timely way. The NDIS is the most significant social policy change since Medicare was introduced in the 1970s. As you might have heard said, we are still building the aeroplane while we're flying it. In looking at this from your point of view from health, where you experience a multitude of pressures all at the same time, it is useful to examine the risks of not doing this transition well. Poor discharge planning, delays, poor coordination, uncertainty, potential for readmissions, these are all unhelpful consequences. The support you need to do this has been recognised by state and territory governments, as well as by the NDIA itself. So apart from offering you information about the NDIS, what we are offering is a training package which has a comprehensive approach to assist you in what you need to achieve.
As Tom was saying, apart from the information about the NDIS, this training package offers a comprehensive set of NDIS capacity building blocks, with the understanding that the training on its own will not create sustainable organisational change. Firstly, executive support for NDIS capacity building is vital to ensure a top-down approach and to create momentum for change. We recommend that an executive portfolio lead is appointed to hold accountability for the NDIS capacity building. Those health services who have invested in a dedicated NDIS project lead or specialist role have been more successful and faster moving with NDIS change than those who have not. Dedicated resources are worth the investment, leading to quicker NDIS-related discharge outcomes and hence less impact on length of stay. Provision of secondary consultation, updating resources in a constantly changing environment, and being a key point of NDIS communication to staff have also been notable outcomes. Alongside these points, NDIS governance structures, including the setup of an NDIS steering committee that includes members of health staff across the whole health service, is vital. Those health services who have implemented a steering committee have found that NDIS capacity building has been less siloed, and with regular meetings, actions have been followed up in a timely manner, leading to faster change. For those health services who do not have a dedicated NDIS project lead, governance is even more important to ensure a coordinated and shared response to change. A whole of health service response is critical to maximising continuity of care, to build trust in colleagues to follow through with agreed NDIS processes, from acute to subacute and on to the community. Although there will be a subset of clinicians where NDIS will be their bread and butter work, it is important to create a culture that the NDIS is a health clinician's core responsibility across all continuums of care. By ensuring all staff practice their NDIS roles and responsibilities, it will lead to less need for crisis NDIS action, such as patients being in an acute setting and needing urgent NDIS supports for discharge. Furthermore, spread of NDIS responsibilities could even prevent an admission if NDIS supports are appropriately in place. If the process is already started or patients can be discharged to other areas across the health system, such as subacute, transition care program, or even out to the community with health clinician support for ongoing NDIS pathway progression, it will lead to NDIS health service cost saving and better outcomes for the person with a disability. Health services should be flexible and creative in discharge planning for NDIS eligible patients, and balance the use of community resources with the high cost of inpatient beds. An example I have seen is using transition care as opposed to someone sitting in a subacute bed, or additional post-acute care provision to support a discharge home while awaiting NDIS supports that may take longer than the normal 28-day post-acute care service. To ensure sustainability of best practice NDIS processes, NDIS-specific policies and pathways are vital. This may include an NDIS practice or procedure guideline, an NDIS flowchart, an internal and external escalation pathway, and a roles and responsibilities guideline. Without these, consistency of practice is unlikely, and a lack of guidance to staff leads to a lack of confidence and low staff wellbeing. NDIS-specific tools and templates, such as a pre-planning template, are also important to get the best outcomes for people applying for and accessing the NDIS. These resources should sit in one central location to ensure easy access and to prevent siloing of NDIS practice across the organisation. Integrating NDIS into existing operational processes, including screening new admissions for NDIS eligibility or screening for existing participants through an admissions checklist, and also discussing in team meetings such as handover, rapid rounds, case conferences, etc., will heighten staff awareness and create a proactive rather than reactive response to discharge planning. Alongside this, an early start, meaning discharge planning right at the point of admission, is strongly encouraged. This means a culture change, particularly for acute clinicians, who should be identifying eligibility and starting access, or identifying the need for an unscheduled plan review due to a change of circumstance to avoid unnecessary delays and impact on length of stay due to the timeframes of NDIS processes. Collaborating with key NDIS stakeholders is another important capacity building step. Becoming familiar with local NDIS providers, in particular support coordinators, can achieve more timely and trusted outcomes. A handy hint is to develop a local list of NDIS providers who work well with your health system that can be accessed by all health clinicians. A comprehensive education and training program are essential alongside the implementation of an NDIS Champions Network to help build sustainability and ensure knowledge spread across the organisation. We encourage you to put NDIS quality assurance processes in place. This might include developing internal key performance indicators around timing of starting access and providing supporting evidence, as well as getting champions to check NDIS reports to make sure the right language is used. These things will reduce unnecessary delays and guarantee best outcomes. And finally, collection of NDIS data can assist you to identify trends and monitor timeframes, which can be used to measure compliance to both internal and external NDIS KPIs and highlight the need for application of escalation guidelines when indicated. Implementing these NDIS capacity building blocks will assist your health network to develop a strong NDIS foundation, which can be used as a platform to then move to streamlining and maximising NDIS outcomes for people with a disability.
Thanks, Michelle. Now it's time for you to take the next step in working well with people with disability in your services, which is our NDIS Foundations training.